introduction. Thanks for having me here, and glad to be talking to a group of folks in global health. I'm an evolutionary anthropologist, and so my interest began more sort of purely in the human evolution scope of things. You know, how our bodies got to be the way they are, how they work today, how our evolutionary past tells us about how they function in today's world. And which is to say, I never planned on helping anybody. That was never my goal. I never had any intention of doing anything good for anyone, or being in the public health sphere. But I was drawn, even initially, to questions about energy expenditure and metabolism, because, as I like to point out to people, you know, life is a game of turning energy into kids. And so evolution likes morphologies and behaviors and physiologies that do a good job of acquiring resources and putting those resources, those energetic resources, into offspring. And so I've been focused on measuring energy expenditures during locomotion, and now more in the last 10 years, just total energy budgets and resting metabolic rates and energy balance for the last 10 years or so. And that's where I've kind of stumbled into this ongoing argument in public health, which is the questions about what ecological factors are the primary drivers of noncommunicable disease in the US and other developed countries. And so these are, you probably know or have seen graphs like this, depressing graphs. The incidence of overweight, obesity in the US is too high and getting higher. Incidence of the prevalence of diabetes is high and getting higher. We're going to adjust the lights a little bit. Okay, for close enough. Okay. It's the afternoon, so you're forgiven. Your circadian rhythms are down. I know Charlie's here. He can tell you why you're going to fall asleep. Yeah, that's right. You're forgiven. You're going to pass. Charlie's here. Anyhow, so you know these cardiometabolic diseases that we're all in this room most likely to die from, as opposed to infectious diseases that would be more dangerous in other environments. These are all either directly or very closely related to issues of energy imbalance, of taking in more calories than we're burning off, getting overweight, obesity are big causes of risks for cardiometabolic disease, diabetes, and cardiovascular disease. So my work in energetics and energy expenditures kind of sort of had a natural entree into this area. And specifically, you know, a lot of these questions have been framed, a lot of these issues of non-communicable diseases, sometimes they're called diseases of civilization, and they're framed that way because the idea is, whether it's implicit or explicit, that our environments today that are built, the zoos that we build ourselves are much different than the environments in which we evolved, and that mismatch sets the stage for disease. And so they aren't always explicitly framed in an evolutionary perspective, but that's often the logic. So for example, the World Health Organization's fact sheet on obesity, if you ask what causes obesity and overweight, they talk about diet, but they also talk about an increase in physical inactivity due to the sedentary nature of our modern lifestyles. So that makes good sense. And I think that these evolutionary perspectives have been really helpful and really influential in public health. But they've also kind of been taken almost sort of at face value, or not thought through very deeply. And what I mean by that is, you know, these evolutionary models of public health are only as good as our understanding of the past is, right? If we don't understand what past lifestyles were like in terms of the physiology and the health outcomes, then we're unlikely to draw the right conclusions about how to fix health today if we think we're out of sync with those past lifestyles. And so I see something like this, and rather than just having to take it sort of at face value that, oh yeah, modern life's less active and therefore burning fewer calories, right? There's an implicit calorie expenditure part of this argument. To take it and just as a given that that's true, I've wanted to go and see if that really holds up. If these evolutionary hypotheses and explanations for why we're sick in the West the way we're sick in the West actually hold up under scrutiny. And the way I've been doing that the last 10 years or so is by studying health outcomes and physiologies in hunter-gatherer groups and other subsistence level economies, populations around the world. Most of my work's been with the Hadza and Tanzania, which I'll show you, and the other work's been with collaborations with other projects, but we'll walk through some of those examples today. So this is just to set the stage for you. You're probably maybe already familiar with some of these numbers, but just to kind of give you a sense of where we're going here, why we think hunting and gathering groups might be an important model for public health, or understanding them might be important for understanding what we're doing wrong in our modern environments. This was framed in terms of diabetes and obesity, but we could do cardiovascular disease as well. Hunter-gatherer populations are extraordinarily healthy. Okay, we have good ethnographic data, good biomedical data going back to the 1900s of a dozen, or 2 dozen, depending on the measure, of populations where we have good data on disease prevalence, and obesity is very low. Type 2 diabetes is so low that we actually have a hard time getting numbers on it. There's less, 1% or less. Heart disease is measured typically as hypertension is very low, even in the old age. And you know, one of the things that I get pushback with this is people say, well, they aren't getting those diseases because they don't live long enough to get them. And that's actually not true. These populations are also wonderful examples of healthy aging. There's a lot of infection disease morbidity and mortality. You're likely to die in childhood from infectious disease. But if you make it to 15, you can actually expect to live into your 50s and probably live into your 60s. And half of the population is going to live in their 60s and 70s. So they're actually wonderful models for healthy aging as well. They don't not get sick just because they die before they can. They live into their old age as well. And so we can just generally frame the kind of questions that I've been asking was have the modern changes in our environment. We've been hunting and gathering for 2 million years, right? We've hunted and gathered well before Homo sapiens showed up 300,000 years ago. So the entire genus, the genus Homo, is a hunting and gathering genus. 2 million years of that evolutionary history. How do modern changes in modern lifestyles affect activity, energetics, diet, health today? Okay, so that's kind of the framing of my work I've been doing the last 10 years or so. So here's a project I want to walk through with you. This is kind of kicked it off for me. It's a project with a population called the Hadza hunter-gatherers in Tanzania, northern Tanzania. This is work I did, I want to make sure I point this out, with Dave Reichland, who's another physiology-minded anthropologist like I am, and Brian Wood, who's a Hadza expert. Brian has spent probably half of his life, the last 15 years, in Hadza camps, so we couldn't do without him. But Dave and I have sort of joined on and started a number of physiology studies and health studies to sort of understand what that's like for the Hadza. So the Hadza live in northern Tanzania. When I say they're hunter-gatherers, what I mean by that is they get all of their food from wild sources. So wild plants, wild game. They don't have domesticated animals, no domesticated livestock, no domesticated crops, no machines. The tools that they have are tools like this axe or a digging stick that they make themselves. No vehicles, no guns. So every day they go out into the wild world around them and get the food that they need for that day. So by the sort of definitional hunter-gatherer group. Just to walk you through what a day is like with the Hadza. You can see here's a Hadza camp at sunset. This is one of the elder men in this group. So in that picture, he's about 65 or 70 years old. You can see a Hadza house here. They're stick and grass houses. Camps are typically maybe 20 to 30 people, adults and kids. So 20 to 30 people would be maybe 4 or 5 families, with grandma and grandpa around, and maybe Uncle Bill and cousin Larry, who aren't somewhere else that happen to be around. Very fluid across the landscape. People move between camps. Women typically forage in groups, so you wake up at dawn because there's no electricity, there's no electric light. So you wake up with the sun. Women typically prefer to forage in groups for safety reasons. And they cover a lot of territory to do it. So women are out getting plant foods, typically going about 8 kilometers a day. It's about 13,000 steps if you're used to thinking about it in terms of steps. And not just walking, they're digging tubers. So starchy tubers are a big part of the diet. They staple wild root vegetables. With a kid on your back the whole time, that's a pretty common way to spend your day as a Hadza woman. So a lot of physical activity. Men prefer to hunt alone, typically. They aren't antisocial, but they'll do better. They feel they do better at hunting by themselves, and they're typically stalking their prey. This gentleman happens to be stalking zebra. You can see this is a bow that he's made himself. He's got a group of arrows he would have made himself. And there's a desert rose bush that they boil down until the sap is a pasty thing, and they plumb that sap onto the head of the arrows. And it's a really powerful coagulant hemotoxin that kills the prey that way. So they can kill, zebra and giraffe, and they hunt those animals regularly. This is an intact ecosystem under a lot of stress, and more stress every year, but outside groups pushing in. But this is an intact ecosystem, and you can hunt big game and small game here successfully. When men aren't hunting, either because they feel like they're not having luck that day, or they just decide to switch it up, they will go and get honey. So here's a baobab tree. You can see how scarred up it is. Here's two guys walking past to give you a sense of scale. These are about 10 meters up into the bole of the tree. And what they're doing, the reason that's scarred up is that they will take a small sort of sapling nearby, cut it into sections to use as pegs, and pound pegs into the soft bark of this tree with their, make a starting hole with the axe, and then use the back of the axe to pound in the peg, and we'll climb up that to get honey. You can see that enormous bucket he's got there. That's the right size bucket. He'll fill that up with honey and comb. And he'll eat as much as he wants to, and he'll fill it up again, and then he'll take it all home. So they all share. Food is always shared. Of course, if you're out foraging, you might sneak a little bit before you go back. There's nothing wrong with that. But the food is communally shared, all the game and plants and honey. And here we get to a nice sort of place to think about what we think, how we imagine the past, and how the past is imagined in public health, and the reality of the data. So, for example, is anybody a paleo diet person here? Anybody paleoing right now? We're going keto, as they say? No? It's too informative a crowd. So a big push in the diet world is to go very low carb, lots of meat, lots of protein and fat in the diet, almost no carbs at all. And some people have really great health results from that. If that diet works for you, I'm not here to tell you to change your diet. That's fine. But it's often argued that it works so well because that's the diet, that's the paleo diet, right? In hunter-gatherer days, we wouldn't have had carbs. Well, these guys are great hunter-gatherers out there really doing it, and they get 15 to 20% of their calories every day on average. It seasonally fluctuates from honey, which is just sugar and water, right? And the starches, the starchy tubers they eat are also just carb bombs. So, again, I think the value of this kind of research in public health is helping us understand what the past was really like. It's going to be really informative. Okay, back to the main event here. Again, great models for healthy aging. We don't see a lot of frailty with these in adults. Men and women into their 60s and 70s. One thing we do is we put ask them to wear GPS when they're out foraging, so we actually get speeds, walking speeds. So think about like a 6-minute walk test. We have 6-hour walk tests. And we can get walking speeds from these guys. They show very little decline. There is a slight decline, you can measure it, but it's very, very slight decline in walking speeds and walking distances every day. The grandmother, this woman's in her 70s, and she had just come home with this, with a satchel full of berries that she'd been picking, and she was sharing that with her grandson. It's a typical day at Hadza camp. She'll go out, she'll do the 8 kilometers, she'll keep up with the 20 and 30-year-old women, no problem at all. So great models for healthy aging. Okay, so let's get back to this. The way I kind of set this up, which is to ask the question, is this active lifestyle protective because perhaps it's burning more calories? Right? That's kind of the standard line in public health, is if we want to understand some of these energy expenditures, all you need to know is how active they are. They'll tell you how many calories they're burning. And again, a lot of the non-communicable disease we see today in modern developed societies, we say is because we were not burning enough calories like we were when we were active. Let's see if that's true. So first of all, a good measurement of activity, that's moderate, vigorous physical activity per day. I should have an axis on that. It's about 120 minutes a day for Hadza, compared to other populations here with the same methods. They get about 7 times more physical activity every day than we do. So it's our impressions from watching them there and living them and with them and going out on forays with them hold up. They're extraordinarily physically active. They get as much physical activity in a day as you get in a week, if you're a typical American. They don't, like other hunter-gatherer groups, they don't have an issue with cardiovascular disease, even in under 65. These are measured blood pressures. And I should say, what counts as high blood pressure here is we've kind of stage 1, or what, I know that just adjusted the guidelines, what was called stage 1 hypertension systolic of 140 or above here as the cutoff. So most of these are still early stage 1, even ones that are hypertensive. And of course, they're not obese, no issues with body mass or obesity. So, okay, then let's ask this question. Do the Hadza expend more energy per day than US and European adults? We should expect they will because they're so physically active. And of course, as someone who's interested in energy expenditure, from an ecological and evolutionary point of view, this is actually why I went to do this project. Why I went to work with the Hadza initially was, again, not a public health issue, but just I wanted to know about energy expenditure in this population. So, to give you a little bit on methods, here's a gentleman drinking some isotope-enriched water. We use what's called the doubly labeled water method. It's the gold standard for measuring calories per day outside of a laboratory setting. And so what that does is you drink some water where the oxygens and hydrogens are both isotopically tagged different. And we can watch those, with urine samples over time, we can watch those isotopes get flushed out of your body as you replace them with regular water. You flush the hydrogens out with the H2O that you excrete as water, so urine or sweat or breath, water vapor in your breath. The oxygens are also lost that way through water, but the oxygens are also lost in the CO2 that you breathe out. So if we watch those depletion curves for hydrogen and oxygen, and we look at the difference in those two curves, those two rates of depletion, the difference tells us how much carbon dioxide you're producing. And you can't burn calories without making CO2. So it's a very physiological, precise measure of calories per day. Okay, so I want you to kind of picture what we'd expect here. We would expect body size to matter, right? Big people burn more calories than small people, so there's a body size effect with energy expenditure. But with that increasing curve of body size and energy expenditure, we should expect the Hadza to be jumped up off that curve compared to other to sedentary Westerners like you, I think. Is what we expected to see. Okay, here's what we actually saw. So here's fat-free mass. We can take any other measure of size you'd like to use, but just to show this, fat-free mass is by far the strongest single predictor, so I want to show you this in the bivariate plot. I'm going to show you against fat-free mass. Fat-free mass against total energy expenditure. The Hadza, as you can see by eye, but I can also tell you from whatever statistical test you want to do, they have indistinguishable energy expenditures per day compared to Westerners. Every dot here's a person, open dots are women, closed dots are men. The closed dots are market economies across the globe, but mostly European and US. There's no difference. So they're 7 times more physically active than we are. They burn exactly the same amount of calories that we do, right? If you're a small body person in the US, you would burn the same number of calories as a Hadza person. Hadza tend to be shorter stature, so a little bit smaller on average than we are. Huge surprise. We didn't expect to see this at all. The grant that we put in to fund this work actually was predicated on the whole idea that we see an elevated expenditure with these guys. So sort of, in some ways a failed study, but what this said to us is we're onto something really interesting and weird here and something worth following up. So this is kind of where we've been following up the last few years. The first thing we thought when we saw this was we screwed up. Right? So we went back and got more data. This is actually not just the first publication, there's other data in here. More data, more years, more camps, shows up. It's all part of the same Hadza distribution. The second thing we thought is, well, maybe the methods are wrong. And so as part of that study, we took a respirometry system out with us, a mask-based respirometry system. We had adults walking around camp to measure walking costs, right? Their walking costs are the same, by the way. So their physical activity isn't sort of magically more efficient. That's not true. It's the same as you and me. But that also gave us a data set of, because we had to wear a heart rate monitor during those tests, of calibrated heart rate against respirometry measured expenditures. So we had calibrated heart rates for each person then that we could use to take heart rate data, which we have them wear heart rates during the study too, every day. Take their heart rate data, put it through this algorithm personalized to them for how many calories they burn per heartbeat, and ask how many calories then do they burn per day from the heart rate data, and it gives us about the same answer as the total energy expenditure data from the available water. So the methods give you the same answer. In fact, they have even lower expenditures with the calibrated heart rate. That probably has something to do with missing calories with that methodology, but that's another story. Point is, same answer, different methods. Okay, well maybe the Hadza are weird. All right, so we want to look for another population. The first population we looked at outside of the Hadza were these guys, the Chimani, another fantastic model of public health, zero heart disease. 2017 paper in The Lancet shows really low levels of heart disease in these guys. They're also hunting and gathering as well as fishing. They do have some cultivation, some sort of simple horticulture, but these are sort of mixed subsistence farming, hunting and gathering groups. And I'm going to show you this data slightly differently. Rather than show you a scatter plot, I'm going to adjust for body size so that I can just give you a point estimate for each. I'm going to give you a bar chart of calories per day, which is the average for that population. And I've adjusted the other populations to the same body size here. And here's what this looks like. So here's physical activity again with accelerometry. Hadza and Chimani both have equally high activity levels. And these are data sets I could take from the literature. And I've ranked these other populations, which are all market economy populations, in order of physical activity measurements. So again, if we think that total energy expenditure should just correspond to activity levels, we should see a correspondence between this graph and TEE adjusted for body size. And what that actually looks like is not at all that. Okay? Total energy expenditures, these are all measured at double available water, don't match. These are all adjusted for body size, don't match this. And even if you don't agree with the stuff coming out of my lab, which you should be skeptical of everything, right? So you can be skeptical of me, that's fine. We would expect that these light gray guys should correspond, but they don't either. These are published measures of physical activity against published measures of total energy expenditures, and they don't match. Okay, so even outside of these sort of different populations, you don't see any correspondence between activity levels and energy expenditure. Or this ratio of what's called the PAL, physical activity level, which is another way of size adjusting. So if you don't like the way I size adjusted this here, this sort of inherently is size adjusted. If we just take your total energy expenditure divided by your basal metabolic rate, that's an inherently size adjusted measure. Again, no correspondence to physical activity. And actually, if I go back to the literature, I'm not the first person to show this. Amy and Luke showed this there very nicely in 2004 paper looking at Nigerian farming women compared to age and size matched US women in Chicago. The Nigerian farming women were obviously very physically active, not the same in Chicago, but the energy expenditures were the same. Well, maybe the Chimani are weird. Let's look at these guys. These are the Shuar. This is a population, different cultural group, actually, but it's similar ecology. They live in Ecuador. Also kind of mixed hunting and gathering and some subsistence farming. This is work done with the Shuar Life History Project, which is people at like Snodgrass and Larry Sugiel in Oregon. But the data collection analysis is done by Sam Urlacher, my postdoc here at Duke. And fantastic, and somebody should give him a job. Hope that got picked up in the recording somewhere. So Sam was looking specifically at children. So we, same methods, but children instead of adults. And Shuar children, as you can expect, quite physically active. So this is a Canadian sample of Western developed country kids, industrialized population kids, low activity level, high activity levels for the Shuar kids. And that's whether you do total activity per day or what this modern business physical activity per day measure. Much higher, about 25 to 50% higher activity, depending on what measurement you like to use. So, okay, they're certainly more active. Their basal metabolic rates are also higher. So with the Hadza and with the Chimani studies, we weren't able to get really great measure of basal metabolic rate for various logistical problems of working in the field. But Sam made it his job, and he did a fantastic job to get proper basal metabolic rate measurements. So, early in the morning, overnight fast, thermoneutral conditions, all things you're supposed to do to get proper BMR data. And when he did that with these Schwartz kids, what he found is they have high basal metabolic rates compared to US and UK kids. It's a 20% increase in basal metabolic rate. And we suspected, based on the Shimani paper that had been done before, again with not as great basal metabolic rate data, that this is probably related to the levels of infectious disease that these Schwartz kids are dealing with. So levels of infection in these environments, as you can imagine, quite high, both elements as well as bacteria and everything else. If you measure cytokines in the blood, circulating cytokines, they're much higher than US or UK sample. And in fact, if we look at the amount, so what he did is he took every one of these Schwartz kids and he asked how elevated are they compared to the US cohort with a bit of statistical modeling. And what he found is that elevation nicely corresponds to, this is just one of the cytokines we measured, immunoglobulin G circulating in the blood. So this is well accounted for, the elevated BMR is well accounted for by immune activity. Okay. So high physical activity levels, high BMRs, probably due to immune system activity. They should have sky-high total energy expenditures. They don't. Okay? Deliverable water measurements. And I should say we send a subset of our samples out to other labs to make sure that we're not screwing up. We run everything, as carefully as we can. These are solid data, and they are the same as industrialized samples, the industrialized kits. Total energy expenditure is the same. And what's weird about that is if you subtract basal metabolic rate and an estimate of digestive costs away from total energy expenditure, and you have what's left is what's often called activity energy expenditure. Beware when people say that they've measured activity energy expenditures in the population. They do that by subtracting BMRs from total energy expenditures, but you can get funny results like this. The Schwartz kids actually have, if anything, lower activity energy expenditures. That's not really true. They're spending more energy on activity, but it looks like it's lower because that difference between BMR and TE is lower. And that PAL ratio, that TE over BMR ratio, is also lower for the Schwartz kids. Again, counterintuitive because they have higher measured physical activity levels. Okay, so what's going on? Here's what I think is going on. What we're taught in public health and nutrition and physiology generally, is certainly what I was taught, is that total energy expenditure corresponds really nicely with physical activity. So if we have some amount of energy that we're spending on everything besides activity, you can call it BMR, let's just call it other. But that kind of is the same all the time. And as I get more and more active, my lifestyle is more and more physically active, this wedge of energy spent on physical activity is going to grow correspondingly. And so this top line number of total energy expenditure is just going to grow in a dose-dependent manner with my level of physical activity. That's what I'll call the additive model. That's the standard way of thinking about this. If you go to the WHO, FAO's website on how to estimate energy expenditures in your population, you're going to go work in somewhere and doesn't matter where, you want to know how many calories are these kids or these adults burning every day, and you can't measure it because you don't have the technology or the ability, it'll say, no problem. Find out how much they weigh, find out how active they are, and that's how many calories your population needs. And it's based on this kind of approach. The population is World War II, and even then we knew it was a guess. That's okay. Here's what I think is going on, and again, this is born from the data. This is the model that I think comes out of the data. That instead of going up, that as we get more and more physically active, our body works to try to keep total energy expenditure at some set point or some window to defend some range. That set point would be some function of our species history, so that we know that species are different. This is some of the work coming out of my lab as well as others. That, for example, humans have higher metabolic rates than chimpanzees. The orangutans have really low metabolic rates. And that's even after you account for body size and activity. There just seem to be real differences in species metabolic rates. So that set point that we all have, whatever yours is, us in this room, probably some function of our evolutionary history, as well as how we grew up, which is an interesting set of questions that we're tackling right now. How does ontogeny affect it? I don't have a great answer for you, but I'm guessing ontogeny plays a big role. And that's the model I would like to suggest to you. Okay, some other evidence for this. So I went to the literature and looked at every case I could find in a laboratory or controlled human study where they titrate up physical activity in a controlled manner and measure energy expenditure. So all the x-axes here are, sorry if you can't read them, I'm sure you can. All the x-axes are measures of physical activity. Depending on the experiment, depends on what the units are. But for example, in a rodent study, you put a mouse on a wheel that's hooked up to a computer. And the computer says, however many rotations you get a food pellet. And then you can adjust that, the program, so that you have to get more rotations per food pellet, or less, right? So you can increase or decrease how much work the animal has to do, and increase activity that way. Or you can make birds fly between posts, that kind of thing. Or you can get humans to sign up to run a half marathon. This is a 1992 study by Western Terp's lab in Netherlands. You get completely sedentary people who do not exercise. You get them running 20 minutes a day, 4 times a week. And then a few months later, you jack it up to 40 minutes a day, 4 times a week. And by the end of the year, they're running 60 minutes a day, 4 times a week, and they're able to run a half marathon. And the total energy expenditure goes boop, and then comes back down. It's the same as it was when they started in the female cohort. The male cohort's a bit higher. Okay. So across all these groups and species, we see the same story again and again. These are the oddballs. There's some variation, but the point is, you see basically a very little correspondence, usually no correspondence, between physical activity levels and total energy expenditures. Again, not just my lab, not just my analyses. This is work done in last year, I think, a little over a year ago now, by Kevin Hall's group in Lennox Kravitz's group at the NIH. They took mice. You have a washing period with no wheel access. You allow them access to the wheel. They run and run and run more and more and more. Energy expenditure has a little blip here, and then they've adjusted that they're completely non-responsive in terms of energy expenditure to their rising levels of activity level. Across primates. So again, another thing that my lab likes to do is measure energy expenditures across species, different set of questions. But one thing we found with that is that primates, first of all, so other mammals, non-primate mammals are in gray triangles here. Every dot is a species average or a cohort average. Sometimes we have different populations of the same species. You can see primates here are all shifted low. It's actually a 50% decrease. It's log space, so it doesn't look very big, but we burn half the calories you'd expect for a mammal our size. But what I want you to pay attention to is this: the captive and wild populations all cluster around the lines in the same manner. So there's no difference between a primate energy expenditure in the zoo and a primate energy expenditure in the wild. And in fact, to bring that close to home, lemurs, who in the Duke Lemur Center, lemur cattle that's been measured here in the Duke Lemur Center in captivity, are actually a little bit higher than the same measurements from the same species in Madagascar in their wild range, their home range. So again, lifestyle doesn't affect energy expenditure the way you think it does, and I think there's almost no correspondence between activity levels and energy expenditures. What's the timing of this? This is something that comes up a lot, so just to think about timing. I'm not saying that if you run a marathon tomorrow, your energy expenditure tomorrow will be the same as it was today, assuming that you didn't run a marathon today. I don't know. Maybe you did, but you probably didn't. I don't think that adjustment happens every day. I don't think it happens a bit like that. I think certainly there's variation day to day in energy expenditures. These are sort of running week-long averages of energy expenditure. I also don't think that if you start an exercise program tomorrow, that your energy expenditure will be the same as it was today. I think your body will take time to adjust to that new exercise program. And the reason I think that is that the best data on timing of metabolic compensation, which is this general phenomenon I'm talking about, is from studies where they use exercise interventions to try to get people to lose weight. So you get somebody in a new exercise program, you know how many calories of exercise you're making them do, and you ask, are they losing weight? Are they losing the weight I'd expect based on the amount of calories they're burning from exercise? And this is weeks of the study. And you see everything all over the map. So if they, this is energy compensation. So if they lost exactly the amount of weight that you'd expect them to lose from the exercise, they'd be at zero compensation. In other words, nothing to explain. If they lost below, if they're at a negative compensation, that means they lost more weight than they were expected to. Okay, that's great. If you are at 100% compensation, that means you didn't lose any weight at all. And if you're above 100%, that means you gained weight, which is depressing. In most studies, in the nature of the way that we do studies and the way that funding works, are sort of 10 and 15-week studies. That's great. It's a good start. But it's all over the map, right? The people who have soldiered on and done these long year-long studies, or a year plus, the results are more and more depressing as the time goes out, right? The arc of energy compensation is long, and it bends towards 100% compensation. That's also another reason I think these ecological measures, these ecological studies like we do with the Pontzer, the Schwarz, the Shimani are really useful because, in a way, they are like studies that have been going on for years, right? So they're all the way out here completely compensated. That's in my biased view, that's how I see it. Anyway, it is certainly true that compensation is stronger as we go along. So the idea would be that your body will compensate within about 20 weeks, 20 to 30 weeks. Okay. So some open questions and some other future directions that I want to go with this that I'll spend the last few minutes talking about. First of all, how do you do it? How do you adapt? One possibility that's been suggested is that you change what's called non-exercise activity thermogenesis. So in other words, fidget less, or sit rather than stand, or save energy in sort of subtle ways that we don't pick up with an accelerometer. That's possible. People have tried to measure that with exercise interventions, and it's a mixed. The evidence is mixed. There's no strong evidence that people actually do that. But I'm sure it could be part of the story. We've measured sleep. They don't sleep more among the Hadza. Charlie and his postdoc measured this for the Hadza. We measured it as well. Not the same numbers. They sleep about 8 hours a day, 7 or 8 hours a day. So it's not that they're sleeping longer. But anyway, there could be other subtle changes in behavior that we're not picking up. What I think is more exciting is the possibility that there are physiological changes happening and that the body's actually adjusting the way it spends calories to make room for this physical activity. And that this could actually be one of the reasons that exercise is so good for you. So, by the way, I'm not arguing that exercise isn't important for your health. It is. It doesn't burn calories the way we think it does, but we know it's still really good for you, and maybe this is why. So what do I mean by that? Well, if we think about, okay, this is our total energy expenditure model of constrained energy expenditure. This amount of energy that's being spent on physical activity is going to cut out other things. More physical activity means less on other stuff. If we're a sort of a smartly evolved animal, then the thing we ought to cut out first is the non-essential stuff. Our bodies should prioritize what gets cut out first. Right? And not just us, any species that's on Earth today and has been through 1 billion years of evolution should have prioritized its physiology smartly. That's the prediction. And so we could argue about what's essential and what's not essential, but that's the overall schema. It probably isn't. It's probably a continuum, not really a binary thing, essential or non-essential. It's probably a continuum of priorities. But the idea is that it's a non-essential task we could define as something that can be deferred or reduced without immediate fitness consequences. It's not going to kill you right now. Okay. Well, I think that can actually explain a lot about why exercise is so good for us. So take, for example, the immune system, right? There's lots of evidence that if we think about inflammation as kind of a non-essential, our high levels of background inflammation that many of us in this room might have, a lot of Americans have, that's immune system activity that you don't really need. In fact, we wish we could turn it off, right? Well, one of the best ways to turn off inflammation is to get people exercising. We know that chronic exercise is a great way to reduce inflammation. Here's some enhanced data. Look at the percentage of people with elevated CRP levels. It goes down, down, down as you exercise more and more. Right? So I see that as done as you exercise more and more and more. if you exercise too much, so that could be one of the reasons we have lower chronic disease and inflammation-related diseases with exercise. Of course, if you take this model too far, eventually you have to cut into the essential stuff. If you give yourself a high enough workload, you will cut into essential stuff. And we know that actually, if you go too far with exercise, elite athletes have overtraining issues, right? They get sick more often, they recover less well from infectious disease. So you have lymphopenia, you have all the telltale signs of a squashed immune system. Reproductive system, okay? Yeah, you need some reproductive hormones to have to reproduce, to have a normally functioning physiology, but you can have really high levels, really low levels, and actually a lot of space for normal variation. If we look at, sorry, we can't quite read this. This is testosterone. This is progesterone. This is populations ranked from the most lazy to the least lazy. So U.S., Congo, Nepal, Paraguay, the Toga, these are pastoralists, and the Hadza are over here. The Hadza, as physically active as they are, and as lean as they are, right? You'd think that would kind of jack up the testosterone levels. We know that exercise can increase testosterone levels in our, with our energetic luxury that we have here in the U.S. But actually, they have 50% of the testosterone levels that we do in the U.S. Again, rank vaguely from least to most active. We get the same thing with progesterone. And this is from a study by Gracia and Jazienska. And the point that she made with this study, and I think this is important, is that actually correlates really nicely with incidence of breast cancer in these populations. So these low, the causation and correlation and causation, not the same thing. Understandably, we need to be careful about this, but it does seem to fit that if you can lower your reproductive hormone levels, you can lower your incidence of reproductive cancers. And in fact, we know that reproductive cancers are one of the best sort of health outcomes you get from chronic exercise. You get a decrease in reproductive cancers. 10 to 20%, even 30% if you know which one we're talking about. We also know that just like the immune system, if you push this hard enough, you can shut the reproductive system down entirely. And you get female triad. You also can get male hypogonadal syndrome. So that actually fits a constraining idea. Another way to think about this is in studies of athlete overtraining syndrome, you can give those athletes food. You can supplement them. There are studies that have done that. It doesn't change the system. It doesn't change the symptoms. And in general, you would wonder why in the U.S. with athletes that could have as much nutrition as they wanted to, why this would ever be a risk. Because you can always go and get more calories. And in an additive framework, that's all you need is more calories, just to keep on riding that top line up as you get more and more active. But in a constrained perspective, you can add as many calories as you want, it doesn't matter. Your energy expenditure is still capped, and you can't actually fix it by adding more calories in because your body just can't burn all those calories. So that's my thoughts on how a constrained model could actually contribute to health. Okay. So again, the typical way we think about this is physical activity leads to increases in energy expenditure, which leads to decreases in body weight. Reasonable, I don't think that's right. Instead, I think what's happening is activity is changing energy allocation, and that's having really important effects on a disease. I want to leave you with a couple things here to last just a couple minutes. One is, well, what about this connection? Okay. Maybe exercise isn't the best way to change total energy expenditures. But if we could change total energy expenditures, would that affect our likelihood of obesity and overweight? Well, this isn't my work. People have looked at this, but I think it's relevant to this conversation. The answer is not really. This is work from Amy Luke. This is work from a completely different lab by Zinkel. These are adults, these are kids. And what this is weight change over, I think this is a 2-year study. This is weight change following kids through childhood. This is percentage. This is weight change in adults. This is fat percentage change in kids. So body composition, because kids, of course, are growing, so of course, are getting bigger. This is body composition changes in kids. And this is 2 ways of adjusting energy expenditure for body size. But in general, if you are higher on these energy expenditure axes, you have a high metabolism, a fast metabolism, which is a true thing, by the way. People vary a lot in their metabolic rates. So some people do have fast metabolism, some people do have slow metabolism. But having a fast metabolism has no effect on your likelihood of gaining weight over 2 years. And a kid's high or low metabolism has no relationship to their body composition as they grow. So I think even this, we have to question. And that would mean that the focus for, if we want to control obesity and body weight on an epidemiological scale, has to be on diet. Because the energy out, the energy we expend is hard to budge, and it doesn't seem to tell us a whole lot anyway about your likelihood of overweight. So that must be the energy in that's getting us out of energy balance at the population level. So what do the traditional diets out there tell us? Okay, if diet is important, what can we glean from hunter-gatherer groups and other groups that don't have this issue with obesity? Is there a paleo diet that we could aspire to? And the answer is absolutely not. Okay, I could calculate an so this is 260 populations. Every dot here on the left is also on the right. This is the percentage of their diet from plants, percentage of the diet from animals. So this is carbs, and this is fats and proteins. Okay. I can calculate an average for you. It would be meaningless, right? The variation is the message here. All of these populations, I can tell you, we have data for a lot of them, are healthy. You can be healthy on any of these diets. Yeah, there are trends, and guess what? If you live where there's no plants that can grow, you don't eat many plants. Okay, you got me there. This actually is not, by the way, people have only been in the Arctic for the last sort of 15,000 years, so that's not an ancestral diet. These sort of temperate and equatorial groups are much more better models for an ancestral diet. And if you want to pick one that eats a lot of meat, sure, that's one you want to cherry pick, and I can pick one that eats a lot of plants, then we can argue with each other on Twitter. And it's useless. The point is, you can do any of these things. So the idea that there's a paleo diet is silly, and I think really not helpful to asking questions about how do we get things better. I made this point before, but these diets are all also very carb-rich diets. The idea that that the previous diets, past diets, were low carb, just doesn't fit. These are food quotients, which are ratios of carbs to fats. The point is they're very high. I'm not going to spend too much time on that. What I do want to spend more time on is this. One thing I think you can say about hunter-gatherer diets and subsistence agricultural diets is that they have a bit less energy per bite. On average, there's still variation, and a lot more fiber. That's something that I've taken away from that literature. So here's Pontzer. Here's another study that did they compiled data for 8 small-scale populations, not the Hadza, but Hadza-like populations. Here's from a recent meta-analysis that compiled data on lean Western diets eaten by developed populations, industrialized populations where the cohorts were lean versus where the cohorts were obese. And you can see there's some gradation there. I would point out that Western diets, the variation of Western diets actually does overlap with everything else. So it isn't a clean break, but at least there's a tendency that it seems to fit that. This paper came out recently and it's fun. Restaurant foods seem to be even worse in terms of energy density. And so, I think there's a lesson here about energy density and foods that are likely to make you overeat. There's about a 30% change here between fast food, for example, and the Hadza diets in terms of energy density. So that's not insignificant. And, again, lots of fiber in the Hadza diet. This is from an analysis that we just did that was mentioned earlier. And a lot less in the US diet. So if you wanted to have a paleo diet, go out and buy a bucket of honey, right? And a lot of wild foods are just full of fiber. And that's a good start. So just summary stuff. I want to underscore that I still think exercise is absolutely critically important. Sometimes people take away from this work that, I don't have to exercise because it's not going to help me. That's not what I'm saying. You still have to exercise. But I don't think exercise works the way we think it does. I think that's an important thing to understand moving forward. Obesity, then, the suggestion of this data is that it's more about what you eat than about how much you move. And I think the public health message should be that diet and exercise aren't two sides of the same coin. They're different tools with different jobs. The reason that this Hansa kid's going to grow up and he's not going to get any of the diseases that you and I are likely to die from is not just because of a diet or just because of activity. It's because he's got both of those tools working for him, and we don't in this society too often. Paleo diets, I've already given you my thing on that. And I just think that, these kind of studies or these kind of populations that we can work with, first of all, the work is super fun, and they're wonderful, gracious, great abilities to work. But I think they're also, they have a lot to tell us about, things that we can bring back here and try to be healthier in the U.S. and other developed, industrialized societies. So I hope I left time for questions. Thanks again for coming, and I'd look forward to questions. Thanks.
Question. Sorry, everyone. A little break.
My acknowledgement slide didn't come up, but I wasn't reshuffled it, so I apologize. This is all collaborative work, so tons of collaborators.
Sure. Great.
Yes.
So, fascinating work. I'm curious about the data collection with the Hansa. So, what was their reaction to you strapping them up with various
Well, in some ways we have it easy because people have been working with the Hansa since, the earliest sort of reports from anthropologists in the field from the 20s, actually. Jim Woodburn kind of started it all off, the modern era of it. He started his data collection in the 50s and 60s. So they've had weird people showing up wanting to understand their culture for a long time. And I thank you for bringing this up, because I should have made the point earlier. They're the best analog for the Hansa that I think we'd be familiar with in the US is the Amish. Okay? They know about the outside world. They know they're different. They love it. They're really proud of the way that of their lifestyle. And so it isn't strange to them that people would want to come and understand them better. And thankfully, and we work really hard to keep this up, there haven't been any of the sort of breaches of trust or big ethical, horrific stories of a lot of other populations. So we haven't, and we all carry that responsibility as researchers there not to break that trust, because they are incredibly generous and wonderful. And of course, we go through informed consent with them. We have to, of course, it's all IRB approved, both on the Tanzanian side and on the U.S. side. But the foundation of it is those relationships. Yeah.
Yes.
Yeah.
Did you collect data in your research about timing of food? Because this intermittent fasting debate.
Yeah, that's one of the things we're going to start looking at. The short answer is no, not carefully. My impression is they kind of eat throughout the day, not so differently than we do. When they wake up, they're hungry. They eat whatever's around. Midday they'll eat again. They eat as the light's coming down around 6 o'clock. One thing, my graduate student Zane is here. He's going to begin working with, we're starting a project with a group called the Dosnich in Kenya. We're going to try to use constant glucose monitoring to get meal timings that way. Because I don't think there's any good data for meal timings with populations like this. It's of course very hard to get that kind of data. You can't ask somebody, hey, when did you eat breakfast? Because they don't keep track of. Even, and by the way, neither do people in the U.S. Food reports, self-reports are impossible to truly use. But anyway, yeah. So we're gonna try that because we'd like to try to explore that question too. I don't know who's first. Yes,
Chris. Two questions. Maybe it's on your acknowledgement slide, but who likes to fund this kind of research? And then secondly, is anybody kind of exploring the mechanism by which the body kind of turns down to keep it at set point?
So who likes to fund it? So far, NSF has liked to fund it. We're trying to get into the NIH world, and we're hoping that happens soon. But if you're offering, we don't never turn our noses up. And in terms of the mechanism, so I've got another thing I should let people know. So I just joined the faculty and in Evolutionary Anthropology, and I am setting up an energetics lab there. And so we're going to try to understand, we've got a metabolic chamber, we've got ventilated water set up to do in-house, we've got respirometries to do in-house, and we're going to try to measure with the metabolic chamber those different components of energy expenditure and see if we can tie those against biomarkers of immune function or reproductive function, that kind of stuff. Just to begin to piece that out. I was just at East Carolina University yesterday talking with Daryl Neufeld down there. And Deb Moyo here in the medical school also has a really fantastic kind of mitochondrial function lab. They do all kinds of amazing, magical stuff. I like to say I don't work on anything I can't see with my own eyes. But these guys are at the cellular level, and so I'd love to partner with something like that. We've already started that discussion.
Yes, so I'm going to ask you a question just to show my ignorance of muscle physiology. But somebody who's been walking all of their lives, and do they get more work so they don't need as many calories to get the same amount of work?
That's a completely reasonable thing to expect. It doesn't. The effect is tiny, and you don't even always see it when you look for it. So people have measured this by doing ergometry tests or treadmill tests in training studies where you have somebody who's completely untrained, sedentary. You ramp them up and give them training and ask.
Wouldn't that account for some of it?
It could account for a piece of it. So when we try to back calculate and model out what's going on, the effect size of efficiency of locomotion is about 2 or 3% of the energy cost of locomotion. It can't explain the whole thing, but it can contribute. When we measured with the mass-based stuff, we measured the walking costs.
I was wondering because the walking thing you didn't see much.
We didn't see anything there.
Yeah.
So in that very gross measure, right? That's different than the kind of at the cell level of the muscle. How much tension does it produce per ATP is consumed? That's a different question. As far as you can tell, again, I'm sure it contributes, but it's going to be marginal. Yeah. Yeah. Bill.
Nice job. I have a question about kind of the transect between urban and ruralness. So I know in the Schwar, I've worked with them.
Yeah.
There's a lot of them that want to be
out
in the woods, and then there's a lot that are fully integrated in the city.
Yeah.
And a place in the Permian Amazon where I work, they have the same thing with a lot of indigenous groups. And when we look at obesity and diabetes and things like that, same statistics as you have in the communities that are far away, that are relatively isolated with no road access, only rivers.
Yeah.
And then as soon as you travel a mile, an hour away, which is when you get to the roads, the same families could be living there, the relatives or whatever, and they have obesity, they have hypertension, and other problems. And I don't know if you've looked at that kind of.
So Sam Herlocker is beginning to look at that, and so he has. I don't have the data to show you yet, but that's exactly what we're trying to get at. So he's got. I don't know how urban the urban ones are, but these are kids that are going to school, living in the village with cement block houses versus kids that were upriver and much more, probably also, I don't know the housing, but much more rural, much more active. And that's the comparison he's doing. And so far it looks like, as you say, as you expect, the kids in town have higher body fat percentages, so they're putting on more fat. We don't see, as a rough first pass, we don't know what the energy expenditure looked like yet, but it's looking like it could be still constrained. So stay tuned to that, but that's what we're going to try to figure out.
Yes.
That was a fascinating talk, very, very interesting. And I'll ask another naive question, just not knowing much about metabolism. So I noticed that you take on the fat when you adjust for the body mass, right? So what would happen if you don't do that? And I'm thinking, obviously being a Westerner, I think about, I've got these 40 pounds I should get rid of. But if you gave me a 40-pound backpack, that would be, I'd burn a lot more calories. So just getting back to my lab. So just carrying around all that fat, how does that affect the situation? And
yeah, again, so we can kind of parcel that out. It's if you do it statistically, you get a weird result where that activity and energy expenditure chunk is actually negatively correlated with fat mass. Shouldn't be in a sort of normal way of thinking about it, but it is. You're absolutely right that heavier people spend more calories to walk. And so that could account for why the
Yeah, I was afraid that was true.
Yeah. Yeah, so again, the short answer is when we've thought about it, we try to model that part of it out. It can't explain all of what we're seeing, but it can contribute to it. But the bigger question in my mind is how fat, as a signaling tissue, as well as just the weight of it, affects physiology and metabolism. I don't think it's as simple as just the weight. There seems to be something else signaling wise that's happening there. That's we're going to try to prove.
It's very interesting. Thank you.
Thanks.